Hello, everyone. This is Dr. Yuying Shen from Norfolk State University. My presentation is about children's experience of the COVID pandemic. My research is entitled Racial Disparities of Children's Social Life, Health, and Healthcare in the COVID pandemic. We all know that the COVID pandemic has presented significant challenges to all of us. It has introduced and accelerated new social practices such as face mask wearing requirement, social distance requirement, quarantine, and it has also introduced and accelerated the application of new technologies like Zoom meeting, virtual learning, online teaching, teleconferencing, teleworking. All these newly introduced social practices actually introduced new variables in our social life, which may help to reinforce existing economic and social inequalities. At the same time, they may also help to create new types of inequalities. So my study specifically wanted to answer two questions. First, how did the COVID pandemic impact children's social life, their health, and healthcare access? Second, are there any racial disparities in children's social life, health, and healthcare in the context of the COVID pandemic in year 2020? My study is a secondary data analysis. Data from the 2021 National Survey of Children's Health was used. The 2021 NSCH survey was administered online and by mail. My study only wanted to focus on children aged between 6 and 17. So finally, a total of 29,607 children aged between 6 and 17 were included in my analysis. I used stratified subpopulation procedures to do a series of statistical analyses to examine the patterns across different racial groups. The key variables in this study include children's race. It has 6 categories. Children's social life. It is measured by their electronic devices application in daily life, the activity participation, the support and safety in their neighborhood. Children's health was measured by both their physical health and their mental well-being. Their health care access was measured by their preventive care access and their needed health care access. Statistical analysis from this study indicate that children from different racial groups experienced the COVID differently. There are significant racial disparities in children's experience. Minority groups such as Blacks, American Indians, Native Hawaii, Native Pacific Islanders, they report further disadvantaged situations such as more mental health disorders, more time on screen, less support lower level of safety and poorer physical health, and they also reported more missed health checkups and more limitations in getting needed health care.